So now based on that, what we do is, let's look at this video. So I have this premolar. How many walls remaining? 2. How many missing? 2. I have lost 2 marginal ridges. That means I will place a post-in core. Any endodontically treated teeth, if 2 or more walls are missing, it needs a post. I know post will weaken the tooth, but it's needed to retain the core. Okay? So I am using a glass fiber post. I place the automatrix. I remove the gutta perca only 6 to 7 millimeters from the orifice in posterior. Don't go more longer. For anterior, 10 millimeters minimum. Then I etch the canal. I etch the remaining tooth. Okay? Wash it completely. And now take paper points. Why paper points? To make sure there is no remaining etchant in the canal, because the canal walls are irregular. Okay? Then I use my adhesive, make it dual cure. You cannot use light cure adhesive only, because you're going 7 millimeters into the canal. Light will not pass. So I'm going to place 1 drop of adhesive, 1 drop of activator, apply the adhesive into the canal, remaining tooth structure, air blow, and then place paper point again. Why I am placing paper point? So there is no pooling of the adhesive. Then I am using my core build-up material as a luting agent into my canal wall. Please bleed the material. See, you should bleed like this on the paper point, so you see it's coming out evenly, and then dispense it with no air voids. Keep coming up with constant touch in the material, and now you bond your post. Okay? And then build your core with the same core build-up material. Once I build up my core, I am going to delay my light curing by 5 seconds. Please allow the material to just gel, okay? Just self-level. And then I am going to light cure. I am going to cut off my auto matrix. And now I am going to do my preparation for an onlay. So please remember, onlay preparation, your margin design, wherever there is a defect. Remember, there was a defect like a class 2 on both sides. It will be butt joint. Wherever there is no defect, it is only a long bevel, inclined plane. And your margin should somewhere lie in the middle third. Don't cut the proximal. See, I have not broken the contact. You see, I have not broken the contact. And that is my overlay. That's by Emax. And this is how I cement. So please place Teflon tape. Etch the prep again. You see, my prep is very supragingival. My margins are not going near the gums. It's only at the middle third. So it's like your tooth preparation, but you are very supragingival because you are retaining tooth structure. So etch, wash after 20 seconds. Please use adhesive resin cement. No self-adhesive resin cement for onlays, because onlays are non-retentive preps. It's not a retentive prep. Okay. So again, dual cure adhesive, because light will not pass through ceramic. Apply silane after HF acid. You use hydrofluoric acid for ceramic, and then silane. Apply the adhesive on the prep, and please lute it with your resin cement or your preheated composite. You see, hold it for a minute and a half. Remove all the excess. After tack curing, please use your floss to remove proximal excess. And when you place the floss, please slide the floss again like this. Don't come up again, okay? Because the cement is still setting. And that's how you finish your overlay. So what is important in this is, these are the preparation guidelines. First principle, you will anatomically reduce the occlusion. Why? Because you want to give space, like how we do for tooth preparation, correct? Minimum clearance required nowadays with good Emax, new Emax, is 1 millimeter. If you have 1 millimeter all around, that's enough. But if you feel the occlusal overload is high, I would go 1.5 millimeter on functional cusp, 1 millimeter on non-functional cusp. If it is a lower molar, buccal cusps I will prep 1.5, lingual cusp I will prep 1 mm. Is it very clear? If it's a maxillary molar, palatal cusp is my functional cusp. So 1.5 palatal, 1 millimeter buccal. That's your first principle, occlusal reduction, okay? After that, as I told you, if your defect is below the equator, what do you mean by that? Below the equator, meaning to say, If this is my tooth, my equator is somewhere here in the center of the tooth, height of contour. If my defect is below the height of contour, I will give butt joint. If my defect is above the height of contour, I will give long bevel. So there are two scenarios. If the defect is above, you will give long bevel. If the defect is below, it's a modified shoulder. 1 millimeter shoulder, 1 millimeter butt joint. Is it very clear? And then you finish off all your preps. This is exactly how your prep is. I have capped these cusps. I have not capped these cusps. It's not necessary you cap all the 4 cusps. Whichever cusp is needed to be capped, you will cap that. And how you know that? Measure the thickness at the base. If it is 2 millimeter or less, I will cap. If it is 2 millimeters or more, I will not cap. Is it very clear? Yeah. So if you cap all the 4 cusps, it is called overlay. If you cap 1 or 2 cusps or less than 4 cusps, it is called onlay. Is it very clear? They are all the same, but the terms are a little different. So then you check the space of your clearance. As I told, minimum is required is about 1.2, or nowadays we can also do with 1 mm. Okay. Never use zirconia as your material of choice. Use always glass ceramic, even if it's a posterior, because it's single tooth, it is bonded. Do not use zirconia. Zirconia is very rigid. I need a material which is close to dentine. Okay. So all your overlays, onlays, inlays will be done with glass ceramic, lithium disilicate, Emax. Okay. And whenever you get an Emax from the laboratory, the inner surface of the Emax, you will use what? Hydrofluoric acid. 5.5% or 4% for 20 seconds. Wash it. Apply silane coupling agent for 1 minute. After that, leave it for air blowing. Then come back to the tooth. Tooth you will etch with phosphoric acid. Apply your universal adhesive. Apply the same universal adhesive on the inner surface of ceramic after silanation. And now you take your cement and bond it. Okay? Is it very clear? Same thing applies for your veneers as well. So this is the X-ray. That's my overlay. You see how it's merging. What is most important is, see, this part is full natural tooth. I have not prepped. And now the question is, will this fail? Yes, it will fail. Anything will fail. But what is more important is, how do I need my failure? How do you want your failures to be? After 15 years, if this fails, this will fail favorably. There are only 2 things that can happen. Either it will be a favorable failure or unfavorable failure. What do you want? Which direction you want to go? Favorable. What is favorable failure? Meaning to say, only will fracture. The tooth will remain as it is. That is favorable failure. If you are doing crowns indiscriminately, you will land up more to unfavorable failures. Okay? So try to preserve tooth structure as much as possible. That's where restorative dentistry is heading. Okay? Any questions?
Do I need to etch the composite veneer? I need to etch the composite veneer.
This one which I am showing, the prefabricated? Yeah, you will etch only if you have contaminated. Correct. So you will etch with phosphoric acid for 10 seconds, wash and then apply veneer bond or silane.
Same bond, composite bond.
No, it's a different bond. Because all composite bonds are hydrophilic and composite is hydrophobic. So you need a hydrophobic bond, not a hydrophilic bond. You got my point? So what is hydrophobic is your silane coupling agent or your veneer bond. Yeah.
We need to bond the same bond in tooth structure?
No, in the tooth it will be regular bond. Yeah. Just want to show you a quick one more system. What is there with the Edelweiss concept is their post and core. They also have a prefabricated post and core. Okay? With a core. So that's the central incisor we are working on. We are removing all the old composite. It's endodontically treated. So usually what we do is when we place a glass fiber post, we build the core, correct? Here it is all ready made. You just have to bond. So see, that's the Gadapoka, see that's the post and core, it's all ready. So you etch, you wash, you apply the adhesive, you use paper points, that's my adhesive, okay, airflow, light cure, I inject my core material as a eluting agent, and now this is the post and the core, one complex, okay, very easy, no brainer. Whatever excess, you just merge it nicely and you get the whole thing in just less than 5 to 10 minutes. Light cure it. And now, if you want to do a crown, you can take a impression. If you want to do a veneer, you can apply the veneer bond and do a veneer. So now in this case, we already had the stent. So we get the lingual shell from Putty Dex. Okay, you see how we do it? Very quickly. We do everything with the same system. We don't want to do a crown, so we are doing a veneer in this case. So we finish this. And now over the top, I will modulate with my composite. See, I place my dentine body, I give my lobes translucency, and now I place my veneer. Okay, so I place my veneer over this. You see how I push it, make sure no air voids. And see, proximal is very important in this case. You've got to push the composite inside so you don't get any excess or marginal staining. So please use your mylar strip. This is very, very important. Tack cure, 3 seconds. Stabilize the veneer. Remove all the excess. And what happens is sometimes you will feel there is some deficiency. So take a little bit of composite and fill it. Okay? Like that, yeah. And then fold the mylar. You get very good contour. And once this is done, you remove and then you finish like how I showed you, only at the margins. See, I'm only finishing at the margins, lingually, proximally. Use your discs, don't touch the surface, use your finishing strip. And then if you see the case, how we finished is this. Okay, post and core, direct composite followed by prefabricated veneer. Something like this in this case, for example, we had to remove one tooth because it was quite compromised. We were planning for implant. So that's the extraction socket. For some reason we have placed the graft. Okay, we have done some remodeling. We are delaying the implant. So now if I am delaying the implant, I have 3 more endodontically treated teeth in which I have to place a post and core, and I have to temporize this patient. I cannot send the patient right away like this until I give them implant and prosthesis. So what we do is we finish quickly 3 post and cores. You already see here. We finish the same procedure like how you saw. So these are my 3 post and cores. That's my implant side. Now I have to temporize all these. So again, what I can do is I can use a fiber and I can place veneers, pontic and veneers. So what we do is we place a fiber. That's my fiber. Place it labially. You don't have to place it lingually. I place it labially. Then I put my mylar. Can you see the mylar on the socket area? So that no composite can go inside. And I start building my dentine core. Can you see that's my composite core on the socket? And then I place veneers 1, 2, 3, and 4, and I finish it. So this is exactly how you can finish it until the patient comes back after 6 to 9 months for implant placement, then a crown. Okay, so it's quite versatile. You can use it in a lot of cases. Okay, so where is restorative dentistry heading? You have to make a choice whether you want to do direct, semi-direct, or indirect. And please remember, there will never be a completely black and white guide. You need to read the substrate. You need to read the remaining tooth structure, and most importantly, you need to perform the treatment with high standard and should have some underlying nod to the science. Okay, please follow research, follow the literature papers, see what the kind of technique, what the material that they are recommending, and follow that. So as Pascal Magni says, take the biomimetic approach. Now everything is biomimetic. You cannot do what you were doing earlier. That is all traditional dentistry. And what is biomimetics? You are mimicking nature by preserving enamel and dentin. Okay? And when you do that, you keep a balance. You maintain a balance between biology mechanics, adhesive, function, and aesthetic parameters. What a restoration needs a balance. It needs a balance between function, aesthetics, adhesive, mechanics. If you are able to do this, your restoration will last longer. Okay?